So in the rhinoplasty consult, I just wanted to talk about, what we do and what's done and what to expect. So we start, of course, by getting a history and understanding, what's been happening with your nose. If you've had a history of any trauma to the nose, have you had difficulty breathing, snoring with sleep apnea? Has there been periods of allergies or pollen issues or sinus disease or sinusitis, drainage from the nose, those types of things? As well as have you had any other procedures on the nose? And frequently we have had patients that have had septoplasties alone or turbineate procedures to help with the nose. And we want to know what things that you've tried. If you have breathing trouble through the nose, have you tried nasal sprays? Have any of those helped? Have you tried breathe right strips or things to help stent open the nose? Have you tried to tape your mouth or, things like that? And what is sort of the influence and implications of some of these interventions? Then we kind of move to, what do you think about the nasal appearance? What are elements about the nose that bothers you? And we want to get a sense of that. This can be subjective. This can be different based on different gender, based on different ethnic group. But of course, we want to have a good understanding of the aesthetics of the nose and what is currently bothering you and what we hope and want to achieve. We move then to certainly an examination where we look inside the nose. We look for inflammation, for septal deviation, for collapse of some of the valves, for enlargement of the turbineates, for presence of any drainage, for presence of any holes or septal perforations. We do some manipulations on the cartilage to see if stenting things in certain areas can help open the breathing. And then we move you, at some points, we'll do an examination with fiber optic evaluation, but frequently we'll just move to our imaging room and we have a CT scan that really three-dimensionally we can look inside the nose. We can look at the ethmoid sinuses, the maxillary sinuses, look for presence of inflammation. We look not only at the cartilaginous septum, but the bony septum for sites of deviation, obstruction, openings, perforations. We look at the turbinates. We look at the narrowness of the maxillary walls or the lateral nasal walls. We can look at all of these various elements. And then we also obtain a 3D photo. So now this is more external, the external component of your nose. We tend to look at that together, understand based on that conversation what is most concerning to you as the patient. And then with that 3D photo, I'm able to do some simulations, not as a guarantee of what the nose will ultimately look like, but more as a communication tool so we understand in general, how do we want the tip projected or deprojected? How do we want the tip rotated or derotated? How refined do we want the tip? Do we look at the ala and the columella on the side view? Do we look at a dorsal bump or hump? And how do we want to smooth that? We want to look at the interface of the upper lip and the nose. We want to look at the nostrils and creating an equilateral triangle from underneath. So we usually do that for a period of time. I typically obtain some regular photos where we're looking at you smiling to see if the nose is changing on smile. And then from there, we talk in more details about the surgery, look at scheduling the surgery, and then go from there. So that's the initial consult. Once the surgery is booked, we see you again. We describe a little bit in more detail what to expect from the surgery, the medications, specifics about logistics at times. We may also review the 3D simulation yet again, and then complete the surgery at the next visit. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.